Hi guys, today we are going to talk about a bit of drug. To starting with, we need to understand what some type of drugs are. They are stimulant, depressant, and hallucinogen. But our main focus today is the most widely used illicit drug in Australia, which is called marijuana. So, marijuana is a type of cannabis and depressant drug, but sometimes would be hallucinogen if smoked with large amount of doses. So, marijuana is the dried leaves and flowers of the cannabis plant. It can be smoked or eaten and comes in a variety of forms. It's classified as synthetic cannabis and medical cannabis. To be used for medical treatment, it must be prescribed by your doctors. Anyway, we have gone too far. Let's come back to the track. To clarify with depressant drug, it won't necessarily make you feel depressed. It only slows down your central nervous system and the messages going on between your brain and your body. The short-term effects of marijuana depends on your interaction between the drugs, personal condition, and environment. Now, what do I mean by the drug? The drug is means to be the purity of that drug. Personal conditions include your characteristics, personality trait, mood at the time, your weight, your gender, your age, your food consumption, which is what you eat before, your general health, and previous experiences, which is about the long-term tolerance to the drug. Now let's take off all this. Short-term effects include problems with memory and learning, difficulty in thinking, and the loss of coordination. Other effects may include sedation, bloodshot eyes, increased heart rate, appetite, and blood pressure. Long-term effect of marijuana depends on how much, how often, and how the marijuana is consumed, which is what I talked about the purity of that drug before. Regular use of marijuana could potentially lead to tolerance to it, dependence to it, and reduced cognitive functioning, sore throat, asthma, and even cancer if smoked with tobacco. Marijuana is relatively easy to obtain in Australia. The average age of first use was 18.9 years old. Imagine that someone in a high school or university had already started using drugs. People aged 20 to 29 are the most likely to have recent use of marijuana. In 2019, approximately 1 in 10 Western Australians had recently used it. People aged 14 and over in Australia, 36% had used marijuana before, and 11.6% had used in the prior of 12 months. This is from a governmental survey in 2019. Some current governmental initiatives to tackle marijuana in general are following the Misuse of Drug Act 1981. Marijuana is illegal to use, process, manufacture, or supply. Penalties vary depending on the offense. Possession offense, which means having the cannabis or marijuana, there's going to be a maximum of $2,000 fine and 2 years in prison. Well, that's a lot of money actually. The second one is supply offense, which is providing cannabis or marijuana to someone else. There's going to be a maximum of $100,000 fine and 25 years in prison. Wow, I can't imagine that. The police officer may use a cannabis intervention requirement, which is called the CIR, if a person is found by police to be in the possession of 10 grams or less of marijuana for personal use and a smoking implement with traces of marijuana. The reference of this presentation has already uploaded with the script to the campus, and Miss Matthew can check it online. Now hopefully you have understood some information about drugs, especially marijuana. But there's one thing I have to point out is that as social economic status increases, cannabis uses decreases. Thanks for watching and listening. I'm the presenter for today.